pain medications. How do they actually work? Let's break it down to make it simple. But first, don't forget to hit like, save, and follow because you might want to come back to this video. The first one are the non-opioid analgesics, which are used for mild to moderate pain. So first, number one is acetaminophen, which is also known as Tylenol. It basically works by blocking the pain signal from the brain. It has very weak to no anti-inflammatory effects, so they're not helpful in reducing the inflammation. So you need some anti-inflammatory if there is an inflammation. So the common side effect for acetaminophen is liver toxicity if overdosed. So you need acetylcysteine on hand as an antidote. Nursing tip, maximum dose is 4 grams per day. And in case of liver patients, you want to keep the dose lower, 2 grams or less than that. It's NCLEX Tip also. So next group of drug is NSAIDs. Non-steroidal anti-inflammatory drugs, which include ibuprofen, aspirin, naproxen, and ketorolac. They basically work by reducing inflammation, pain, and fever by blocking the prostaglandin synthesis, which is also called pain chemical. So the common side effects are GI ulcers, kidney damage, and increased bleeding risk. So NCLEX tip or nursing responsibility is to avoid in case of the kidney damage and in case of active bleeding, our patient who is at risk for bleeding. The next group is opioids, which are used for moderate to severe level of the pain. The common examples are morphine, hydrocodone, fentanyl, and oxycodone. So they work by binding the opioid receptors in the brain and blocking the pain signal. So the side effects to monitor very closely: respiratory depression. Your patient might have slowed breathing, so you might want to hold the medication if the respiratory is below 12. Number 2, constipation, which is also again common because the morphine or opioids are going to slow down the body. So everything is going to slow down, even the gut. And number 3 is you want to observe for the drowsiness because of all that slowness. And number 4 is sometimes it can cause the addiction risk as well. So as I mentioned before, you want to watch your patient closely when they are on these meds, and respiratory rate, if it is less than 12, you might want to hold the medication. And you will want to keep the antidote naloxone, which is also called Narcan, ready on the bedside in case your patient needs it. Next group of medications are adjuvant medications, which are not exactly the pain medications, but they do help with the pain management. The common examples are like antidepressants like amitriptyline for the chronic nerve pain and the neuropathy. The group of drug is anticonvulsants like gabapentin in case of the patients who are experiencing nerve pain. The third one is muscle relaxants like baclofen for the patients who are experiencing muscle pain and sprains. As a nursing responsibility, you want to watch your patient for the drowsiness, and they will be at risk for the fall. So you might want to do the fall risk. Quick nursing responsibilities, which usually NCLEX ask about, is you want to assess your patient before and after giving them pain medications for their level. Number 2, you want to monitor your patient for the common side effects like opioids and the respiratory depression. And number 3, you want to educate your patient, no alcohol with opioids, stay hydrated with the NSAIDs because they are for kidney damage, right? So you need to increase the fluid intake so that it can wash the kidneys up and to prevent the kidney damage. I hope this video helped, and if you like my video, don't forget to hit like, save, and follow. And if you want me to cover any specific medication for your NCLEX preparation, put that in the comments and I will make my next video on that. And I'll see you guys in my next video.